Breast cancer is a disease that affects millions of women worldwide. Many people are unaware of how this disease starts and what the early signs are. Our goal is to raise awareness about the importance of breast health care. If you're new here, don't forget to subscribe and ring the bell so you won't miss any content. Let's learn together about breast cancer. What is breast cancer? Breast cancer is a disease characterized by the uncontrolled growth of malignant breast cells. These cancerous cells can form a tumor in the breast tissue and may spread to other parts of the body through the lymphatic system or bloodstream. While breast cancer is more common in women, it can also affect men. There are various risk factors associated with this disease, and often the early symptoms are overlooked or confused with other conditions. Now, let's list the 10 early symptoms of breast cancer. 1. Lump in the breast or armpit. One of the most common and alarming signs of breast cancer is the presence of a hardened lump in the breast or armpit area. This lump may be palpable during breast self-examination or discovered by chance. It's important to remember that not all lumps are cancerous, but any change should be evaluated by a doctor. Early detection can make all the difference in treatment and recovery. If you notice any irregularity, don't hesitate to seek specialized medical advice. Your health deserves constant attention and care. 2. Changes in breast size or shape. Noticeable changes in breast size or shape can be a warning sign for breast cancer. This may include asymmetry between the breasts or a shift in how one breast sits compared to the other. These changes may be accompanied by discomfort or tenderness in the affected area. It's essential to be aware of these changes and, if noticed, consult a doctor for proper evaluation. Observing and caring for your body are essential to identify potential health problems as early as possible. So, pay attention to changes and don't ignore the signals your body may be giving you. 3. Changes in breast skin, such as redness or scaling. Changes in breast skin can be a concerning indicator, especially if there is redness or scaling. These alterations may be signs of inflammation or infection, but they can also be associated with breast cancer. The skin on the breast may become irregular or hardened, and nodules or swelling may form. It's essential to be vigilant about these changes and consult a doctor if you notice any alterations in breast skin. 4. Nipple discharge. The presence of nipple discharge, especially when it is bloody, is a sign that requires immediate attention. While not all nipple discharge indicates breast cancer, it's a symptom that shouldn't be ignored. The discharge can be clear, yellowish, greenish, or bloody, and may occur in one or both breasts. This secretion can be spontaneous or noticed when pressing or squeezing the nipple. The presence of blood in the discharge is particularly concerning and may indicate malignancy. If you observe any abnormal nipple discharge, it's crucial to seek a doctor for a detailed evaluation. 5. Breast or nipple pain. Feeling pain in the breast or nipple is a symptom that can be concerning and should be evaluated by a healthcare professional. The pain can range from mild to severe and can be constant or intermittent. Some women report a burning or tightening sensation in the affected area. It's important to note that breast pain isn't always related to breast cancer and can be caused by various benign conditions, such as hormonal changes, mastitis, or breast cysts. However, persistent or unexplained pain should be investigated to rule out any more serious issues. Medical evaluation is essential to determine the cause of the pain and initiate appropriate treatment if necessary. Remember that early detection is crucial for successful breast cancer treatment. Pay close attention. Your health is a priority, and being aware of your body's signals can make all the difference in diagnosing and treating potential problems. 6. Swelling in the breast area. Swelling or edema in the breast is another sign that may indicate a problem and requires medical attention. This swelling can occur throughout the breast or in a specific area and may be accompanied by a feeling of heaviness or fullness in the affected region. In some cases, the breast skin may appear stretched or shiny due to swelling. It's important to emphasize that breast swelling can be caused by various conditions, such as inflammation, infection, or even fluid retention, and isn't always related to breast cancer. However, persistent swelling or lack of improvement over time should be evaluated by a doctor to rule out the possibility of a more serious problem. Additional tests, such as breast ultrasound or mammography, may be necessary for an accurate diagnosis. Therefore, If you notice any type of swelling in the breast area, especially if it's accompanied by other concerning symptoms, it's essential to seek medical guidance for a comprehensive and proper evaluation. Don't ignore your body's signals. 7. Changes in breast skin texture, resembling an orange peel. If you notice changes in breast skin texture, such as a wrinkled, wavy, or orange peel appearance, it's important to be vigilant. These changes in skin surface may occur due to fluid accumulation in the tissues, known as edema, which causes the skin to stretch and acquire this characteristic appearance. This symptom may be accompanied by a feeling of warmth, itching, or discomfort in the affected area. Although these changes in skin texture can be caused by other less severe conditions, such as infections or allergic reactions, it's essential to consult a doctor to assess the underlying cause and rule out the possibility of breast cancer. 8. Retraction or inversion of the nipple. Retraction or inversion of the nipple occurs when the nipple becomes turned inward or retracted into the breast, instead of pointing outward, as is common. This alteration in nipple shape can be noticed both at rest and during breastfeeding or stimulation. Nipple retraction can be caused by various conditions, including infections, injuries, or benign changes, but it can also be a sign of breast cancer. It's important to be aware of other associated changes, such as pain, discharge, or nodules in the breast area. If you notice any retraction or inversion of the nipple, especially if it's a recent symptom or accompanied by other concerning symptoms, it's essential to seek immediate medical evaluation. 9. Ulceration on breast skin. Ulcers on breast skin are wounds that do not heal and may present redness around them. Although they can be caused by various conditions, such as infections or dermatitis, it's crucial not to ignore this alteration. The presence of an ulcer on the breast, especially when accompanied by other symptoms like lumps or discharge, should be evaluated by a doctor. Diagnostic tests, such as a biopsy, may be necessary to determine the cause and initiate appropriate treatment. 10. Feeling of a lump or thickening of the skin on the breast. Feeling a lump or thickening in the breast is one of the most common and important signs of breast cancer. This lump can be felt during breast self-examination or even during daily activities such as bathing or dressing. The thickening of the skin on the breast can also be noticeable to the touch and is often accompanied by changes in skin texture, such as roughness or wrinkling. These changes may be caused by cancerous cells multiplying and forming a tumor. If you detect any lump or thickening in the breast, it's essential to seek immediate medical evaluation. The healthcare professional can perform a detailed physical examination and request additional tests, such as a mammogram or breast ultrasound, to determine the cause and guide appropriate treatment. These symptoms can vary from person to person, and not all women will experience all of them. However, if you notice any suspicious changes, it's essential to consult a doctor for evaluation. Early detection is key to successful breast cancer treatment. Share this video if you think it may be useful to someone you know. And if you don't perform self-examinations regularly or haven't had a mammogram recently, take care of your health and encourage other women to do the same. Together, we can make a difference in the fight against breast cancer. Until the next video.